What's up, everyone? It's Dr. Andrew. Welcome to Body Awareness. If you're a first-time viewer, please subscribe to my channel, and you can check out some other great videos on how to be more aware of your body and avoid injuries. But today we are going to be looking at lateral epicondylitis, which is the fancy term for tennis elbow. So they call it lateral epicondylitis because it's on the lateral epicondyle, which is right here, and itis is just a word for inflammation. So it's inflammation of the lateral epicondyle. And generally what that is inflammation of the tendons of the wrist extensor muscles that attach on the lateral epicondyle. So if we do a lot of writing, if we do a lot of typing, if you're playing tennis, if you are gardening and using the weed eater or the blower, you can get a lot of pain right here in the lateral epicondyle, and it is very debilitating. People have a really hard time getting rid of this pain and continuing with normal daily activities when they have this issue. So today we're going to look at how to treat it and how to make it feel better. First, let's talk about why we have this pain. When we are doing gripping activities, the wrist needs to be in a little bit of extension in order to have a stronger grip. If we're trying to grip like this and wrist flexion, then we're not going to be very strong. We have to have a little bit of extension in order to grip really, really tightly. And when we do that, you can see that these muscles right here are very active, okay? And if we do that for an extended period of time, then we're going to have lots of inflammation in the lateral epicondyle. So let me show you two examples of things that you do in the house that are going to give you the pain right there. So first of all, when we have a blower, in order to grab the blower, we are in a little bit of wrist extension right here, okay? And just you can see these muscles right here, they're just always on, they're always tight and they're always contracted. And when you do that for a long period of time, especially when you go back and forth like this, and you're just slowly contracting these muscles into eccentric and concentric contraction, then you're going to have tons of inflammation right through this muscle and obviously right up in here where they attach on the lateral epicondyle. Also, when we look at holding the weed eater, when you hold right here the weed eater, this is the thing that gives me the most issues. When I use my weed eater, I feel lots of tension and pain in here for about a day afterwards. Thankfully, it's not longer. But look, when you're holding here, I'm holding it with a little bit of wrist extension, okay? So these muscles are going to be contracted the entire time. And typically when you weed eat, you're doing it for 30 minutes to an hour. So that's a lot of time for tons of tension to be put through these muscles. So what can we do to treat this? Well, the first thing we're going to do is we're going to start off with some gentle stretching of the muscles and of the tendons. So how do we do that? So if my right side is the side that's bugging me, what I'm going to do is I'm going to extend the elbow, because when you extend the elbow, you're going to get more of a stretch. If you keep it right here at 90 degrees, it's not going to stretch as much. So we're going to extend the elbow. I'm going to take my other hand, hold the hand that hurts, or not the hand that hurts, hold the side that hurts. Okay, I'm going to push my hand into flexion, just like this. I'm going to make sure that the elbow stays nice and extended. And then if you want to, you can open up the elbow like this, and this is supination, okay? So with your hand pushed down and then pushing your arm into a little bit of supination, you're going to feel a really nice stretch right through these muscles, okay? Now if you're really inflamed, if you're really hurting in this area, then you're not going to need to push very hard, okay? You're just going to push lightly and you're going to automatically start to feel that stretch. So with any stretch, I like to hold it 20 to 30 seconds, and then after that you're going to relax, okay? You can rub it a little bit, you can shake your hand out, okay? And then you're going to rest for about 30 more seconds, okay? And then after that you're going to do it again. And we're going to do 4 to 5 stretches, and each one is 20 to 30 seconds. So the next thing we're going to do is exercise, because a lot of times when people have this kind of issue, it's because their forearms are generally fairly weak. So what we want to do is we want to do some wrist extension exercises. We want to do some pronation and supination exercises, okay? And some radial and ulnar deviation exercises. So for wrist pronation and supination, we can grab a hammer, okay? And obviously the bigger the hammer, the harder this is going to be. And start off holding closer to the head of the hammer, because the farther away you are from the head of the hammer, the harder it's going to be as well. So what we're going to do is hold the hammer right here. We're going to keep our elbow against our side and keep our elbow also at 90 degrees. And and we're going to dip into pronation and then dip into supination, just like this. All right, and we're going to rotate like that about 10 to 20 times. Okay, and remember the goal with this is to strengthen the muscles in the forearm. You don't want a ton, if there's a lot of pain with this, then just start off literally with no weight, okay? And then you can add in the hammer. And then as it gets easier, you can hold it lower down, and then right here, that's when it gets a lot harder and you can feel it more in the forearm. Okay, but we're gonna do about 10 to 15 repetitions, and we're gonna do three sets of that. So the second exercise we're going to do is radial and ulnar deviation. And basically what we do there is, I'm going to show you from the side here. Keep the elbow right here at your side again, 90 degrees, and you're going to dip the hammer down and then bring it back up like this. Okay, down and back up. And you want to make sure that the forearm is staying in neutral and it's not dipping and coming up as well, because when you do this, you're just working the bicep, okay? So to really focus on the muscles of the forearm, then we're just gonna move the wrist and not the elbow, okay? So again, you're gonna do 10 to 15 repetitions and relax, and you're gonna do 3 sets of that. So another really great exercise that you can do is basically bicep curling in a pronated position of the forearm. Okay, so remember, this is pronation, this is supination. So we're going to have our arms in pronation and holding a bar. If you're at the gym or if you have one at home, this will be really good for you. But you're going to hold a weighted bar like this, okay? And you're just going to curl up and then back down, just like this. Up and then down. This is going to work your forearms, the wrist extensors. It's going to work your biceps. This is going to be this is my favorite exercise that I use with people that have lateral epicondylitis. So again, 10 to 15 reps, about 3 sets of that. As you get stronger, you can increase the weight with this, but try to stick around about 8 to 12 repetitions with about 3 sets. So the next thing we can do to treat lateral epicondylitis is called an ice massage. Now I love an ice massage because it really combines 2 amazing things, a massage and ice. Because massage is going to help reduce stress and tension in the muscles, and then the ice is going to help reduce the inflammation. So what we're going to do, I did not think ahead, and I don't have a frozen cup of ice, but what you're going to do is you're going to take a paper cup, fill it with some water, okay, about halfway up or so, and then once it's frozen, you're going to rip off, oh gosh, am I going to be able to do this? You're going to rip off around the ice, just like this, okay? So imagine that there's ice kind of poking out, and then you're holding the other end, okay? So we're here, and then you're gonna put the ice on your elbow. You're gonna relax the arm on a table or something, okay? And then you're just gonna press down and massage that elbow where it hurts with the ice, and do this for about 5 to 10 minutes. You can go forward and back like this. You can go up and down along the muscle, and you can do circles, okay? All that's going to feel really good. Ice plus massage is awesome. So do that about 5 to 10 minutes and it will feel really good and you'll get some good relief. And my suggestion is to do that at least once a day, maybe even twice a day if you can. And the last thing that I'm going to suggest that you do to treat lateral epicondylitis is something that is probably the hardest thing that you're going to have to do, and that's just try to rest. You need to rest the arm that hurts from the activities that are hurting it. So if using the blower, using the weed eater hurt, then don't do that. If typing on the computer or writing a lot hurts, then try to limit how much you are doing that, or try to take frequent breaks and do the stretches, do the ice massages in between while you're working. Because honestly, with any kind of chronic issue in a muscle or a tendon, rest is going to be the #1 thing that's going to help get it better. So if you can rest it, get the inflammation to go down, do the other treatments that I told you to do, and then get it to feel really good, strengthen it. Then when you get back to doing those activities at full capacity again, then you will definitely have less pain and your muscles will be able to take that tension with a lot of less pain. Yeah.
Okay.
Well, that wraps up lateral epicondylitis / tennis elbow. I hope you learned something. I hope this was easy to follow, And if you enjoyed this video, please like my channel. No, subscribe to my channel, like the video, tell your friends, and we'll look forward to seeing you on the next video. All right, bye-bye. What's up, everyone? What's up, everyone? What's up, everyone? How about that? Piggy eye. Hello, everyone. This is Dr. Andrew. Hello, mate. Top of the morning to ya. Hello, everyone. This is Dr. Andrew.
You're recording that.
I know. It's okay. All right. Shh.